Well, thank you very much, Mike. I think you sort of set us three challenges as we started the workshop. One was to try to focus on issues that are important in terms of access to products of assured quality that are affordable for the populations that need to have them, and to focus particularly on areas of the world that are perhaps less well-resourced than here. A second is to come up with some solutions, and I'll try and offer maybe 5 or 6 solutions. And the third, and perhaps most difficult of all, was to come up with a regulatory joke. Now, I'm not going to be able to do that, but that does feed into the first point that I'd like to make and the first sort of solution that I'd like to try to offer. And I think one of the challenges that we need to face up to is, and Tom was mentioning this a little bit this morning, what is the incentive to invest in international standards harmonisation? And I've heard it several times in the course of this meeting from speakers here. It's obvious, of course, it makes sense. Well, it does to us, because, that's what we do. But I think if we are honest and we think, well, once you step outside of this room, does it make sense to other stakeholders that we need to speak to? Does it make sense to your management that, to get the resources that you need to properly do the work of international harmonisation? And I don't think it does. We heard several times people saying, well, we have to work with the resources that we have. I know I have to struggle with my own senior management to get resource for this. So that suggests that we're not making the case well enough for why we need to do this. If you go and speak to the donors and say, would you like to invest in international standardisation? They say, why? WHO has commissioned some work to look at what is the response from donors if you ask that question. And there are 2 things that come out of that. First is they say, well, either you're invisible, in other words, donors just don't understand why should they do this, or worse, they see us as a problem. We're the block, in terms of access to those products. So that, to me, says we've got a major challenge ahead of us in terms of explaining the case. Now, having some jokes on board, well, might help, but I don't think that's really the solution. What we need are a good advocacy case, some good stories to sell why should there be investment in this case. What is the, and we were saying this, we need the business case, but we've got to, before you go to the business case, you've got to create the sort of the incentive for people to invest, and we need to do better, I think, at creating some advocacy tools. So one solution is that we come up with some good stories, some material that we can use collectively as to advocate why should there be investment in this area. A second challenge that has come up, I think, during the course of the meeting is the maybe lack of attention that we collectively have applied to the implementation of our work. We put a lot of effort into getting to a harmonised standard in the first place, and then we haven't paid enough attention to actually making sure it's implemented. And Lou is saying this as well. And I think that is something that, as a group, we need to be thinking about. How can we be smarter about getting that implementation phase to work better than it does at the moment? And, we've heard some ideas exchanged during the course of the discussions. In some standards, there are examples built in, to try to help better understanding, for example, of what the standard actually means. And people are saying, well, okay, that's fine, that helps, but it's not really, enough. From WHO, we've run workshops. When we've developed a new standard, we've taken the standard developers, out on a roadshow, if you like, to people who have not been involved in the standard setting process, to begin to have an exchange. And also, very interestingly, we've worked with industry partners who have contributed real data for case studies. And it's only when you have a case study and that people are to illustrate how you would apply a new standard, to have that interaction, that you begin to come up with some measure of implementation of new standards. So these are just ideas that people have floated around. And what I would propose as a solution is that we create some sort of information exchange about ideas that have worked, ideas that haven't worked, in terms of implementation of standards, a workshop or whatever on implementation, and to create some ideas and new initiatives around how do we implement standards. A third issue that I'd like to bring up and solution is around the capacity building. We've all said we need to build capacity. But there's a very good question in the workshop yesterday. Well, can you tell us how much capacity you need to build? Does every regulatory agency in the world need to become like US FDA? Of course not. But how do you know what's enough in any particular circumstance? And I think that we need to, there are some tools that can help us answer those questions. And in particular, one of the solutions that we found very effective is what's called the Institutional Development Plan. Lembit mentioned it on one of his slides earlier today. This is a plan which is basically developed on the basis of an audit by peers. So WHO can facilitate an audit of a regulatory authority where we bring in a team, and typically that team will be composed of experienced peers and less experienced peers. So it's a learning experience in its own right with the auditors. But essentially it looks at an authority against a set of criteria to see, I do have all the functions in place. Which are the functions which are appropriate for your circumstance? The circumstances are not the same in all countries. So you can come up with a stratified approach to what are the appropriate functions for a regulatory authority to have in place. And you do this as an external audit of the authority, which then yields this institutional development plan. And this is the solution I'd like to offer, a very, very powerful tool, because it sets out a very evidence-based plan for further development. It identifies where are the training needs, for example. And again, as we build capacity, one of the problems that we have is trying to match the training needs appropriately. It's a wasted opportunity if you train somebody in the wrong thing, or if you train somebody who's about to leave the next week, which happens. So, this provides a framework to say, okay, these are the training needs that you have as an authority. They've been identified through an evidence-based process. We can now facilitate you building the appropriate capacity. And moreover, that institutional development plan needs to go beyond the institution itself. It needs to be agreed by the government, so that you've got broader support for that plan. And the sustainability, this was mentioned by Raymond, sustainability is key in this area in terms of trying to build capacity. So I offer the institution development plan as a solution. Another area where we're talking about harmonisation versus convergence, etc., etc. And particularly as we're looking at convergence, the key issue there is actually mutual trust. And how do you build mutual trust between authorities so that there is a measure of reliance on decisions or inputs from peers. And we've heard a number of times that joint activities are the way to go forward, and absolutely that's the evidence that we can see from things like the AVREF forum, which brings together not just the drug regulators, but also the national ethics committees. So AVREF is a forum that focuses on clinical trials, and it's particularly useful in the context of multi-country clinical trials. So we bring together 19 countries from Africa, both the regulators and the national ethics committees. They sit together, they hit, and we've got tremendous support from the well-resourced regulatory agencies, FDA, EMA, Health Canada, for example. They send their experts as well there. The sponsors come along as well, present their products, they're in the pipeline. And this is this neutral platform for everybody to discuss, to hear what are the issues, that then helps build mutual trust between neighbouring countries, for example. They can see who's doing what and what is the quality of the inputs of those peers in this environment. So I would suggest that networks like Avaref are very useful, and we should be looking to expand that to other products. The final thing I would just mention is how do we leverage support for the regulatory science base for the products that we're particularly interested in this session, products that are going to the least resourced countries. The regulatory science base is actually very small. You know, we haven't got a big, huge pool to draw on. So can we come up with ways in which we prioritize our efforts and try to work out a joint plan of action, a work-sharing plan? And it can be done. In the area of vaccines, which is where I come from, in the last couple of years, there's been a lot of work put into developing what's called a global vaccine action plan. This is a plan for up to 2020 as to what countries want to see in terms of new vaccines coming into their populations and sustaining the gains that have already been made through immunisation programmes. As part of that initiative, we're able to convene a group of regulators that have got a regulatory science capability to say, can we come up with an agenda for regulatory science, for vaccines, for the next 20 years? What are the key issues that we should be collectively working on? And we're able to do that. That's a publication which is in the press at the moment, which basically sets out that regulatory agenda. I wonder, can we do this again for other product areas so that we've got agreement on what would be some of the key areas to work on so that we can maximise the use of what is a very scarce resource in terms of regulatory science. So, Mike, I hope that's given a few sort of ideas as practical solutions that might help take us forward in some of the areas that we've been mentioning. Thanks.
That's great. Thank you, David. So next is Vincent Ahunkai, the Deputy Director of Regulatory Affairs at the Bill and Melinda Gates Foundation.